आगे मंचे ब्याराम होतो डिजीज होतो या डिसऑर्डर्स कल्ला होदे होदुन चीजों कलर मारे जेरे आरतु न्यूट्रिशनल लोई मतलब न्यूट्रिशन जिन आसे खाना फिना जिन न्यूट्रिशन सकल आसे हिन लोई चेंज गुरी फारे देता ला इतरारे या डिसऑर्डर सकल हो instead of saying the disease. So but at the same time it's a same thing. So when we say about the degenerative तो इबा mainly आतिका तोरा तो हुन लकली को हदानी आरा डॉक्टर सकल तो main चीज फोला क्लिक ओ तो दे या ओ दे it's something to do with the old age ने मनुष्यगा old ओले और second चीज आई दे मेलाफाइन Malafano no औरतें, women who are already adult, having children, mothers, elderly people, okay? Third चीज आई दे कि click आई दे कि fine, because they don't get a proper food, a proper nutritions, and not enough calories. Fourth चीज आई दे गोरीफ या conflict मारे या camp मारे ताके दे, okay? So when we talk about the degenerative, it always clicks those categories of the people. Achha. It's a very complicated, and as I've said, we being a woman, we are double complicated, and we being older, it's triple complicated, but it's a complicated disease, and it is very important to know about it, at least have a little bit superficial information, what is needed and what is not needed. For these things, it's also very important to understand the clinical signs, you know, and some of them also needs blood work to check, and the blood work are very expensive, especially when it comes to the degenerative gorafule. It is quite expensive. Like sometimes we need scan. Without the scan, without the MRI, without the CT scan, without the bone scan, it is quite difficult to diagnose them. And as I've said, it is important because the earlier you diagnose, the earlier you give the treatment or the replacement, the person will have some relief from the disease and from the further bad prognosis. Third thing what you need to know about this disease is that it needs a constant treatment. Constant treatment means, for example, if somebody is having a vitamin D deficiency, which you will know later how we treat it, and then by taking 1 week of the medicine or by eating a food rich of vitamin D, it will not help. You need a constant, at least to have a change from 4 to 6 weeks. Okay? Acha, tole, let us go to the second slide. You might have read last year or went through a system called connective tissue. Okay? This connective tissue is composed of cells, extracellular matrix, you can say it ECM, and the ECM includes of collagen, elastin, and proteoglycans. There are, for example, in cosmetics or our youth who are going for the fitness, you know, they will take some extra collagen, or the women, very famous celebrities who can afford expensive cosmetics or nutritions, they usually take extra collagens to feel their body beautiful and the elasticity to be better and to look better also and healthier. Okay, so as I said, it composed of cells and the extracellular matrix. Extracellular matrix are the collagen, elastin, and proteoglycans. Our third generation.
Ma'am, what is questions mean?
We will give the questions later because I am very much limited with the timing. I will have the questions, we will answer at the end. We just write it down, the questions, and then we are going to answer at the end of the day. Because I was told to prepare more slides, to prepare more informations, so that you people can prepare at home instead of me questioning and answering. Okay, so let us do it. The questions, inshallah, I will have enough time, and I hope you will have enough time too. Let us do it, otherwise I'll be disturbed. Okay, good. তুমি লিখে রাখো নে, inshallah. And jawab দিম. Okay, now degenerative disorders. Okay, so the definition is it's involved the disorders which the progressive deterioration of cells, tissues, or organs, often due to age, wear and tear, or chronic damage. Okay, so it's a disorder which progressively deteriorates of cells, tissues, or organs, often due to aging, often wear to tear. It means that these are due to accidents, due to fractures, due to food and the chronic damages. And then the key features of these degenerative disorders or diseases are the gradual onset, often irreversible, osteoporosis osteoarthritis deformities for the long period hinare wapis lo jane fare na fare zindela vitamin D mare fare hindela osteoporosis khodunam mare na fare, and it worsens over time iba worse ho jaoge. Acha, because we are getting older, maybe we are not getting the proper food, and with the age other diseases are combining us. Okay, good. Examples are very easy. Osteoarthritis, I must say that you people have heard already on or seen during your practices in the camps among our people, and especially among the ladies. Alzheimer's disease and the Parkinson's disease. It's a very complicated diseases. These are neurological diseases and the degenerative disease also, which is hard to diagnose in our community because we don't have that much skills to understand. And we will always say that this is disease is because he's old or she's old, or because, you know, he's not, what do you say, he's getting old, or he's not properly taking the food, or because we don't have enough aid or enough donations that we are provided from the UNICEF or the UNESCO or from the UN, that we hardly, or the refugees organizations, that we hardly get a proper food. And that can play a role, but you know, it's quite difficult to diagnose. I personally cannot diagnose Alzheimer's disease and Parkinson's diseases because being a child specialist and not being a neurologist, it's quite difficult and it's quite challenging. But these occurs, and if we don't take care of them initially, the prognosis are quite bad, and it also very hurting. Okay, then the causes, as we said earlier: aging, genetic factors, lifestyle, food, poor diet, inactivity. You know, sometimes what we do in our community when it comes to the Myanmar, in the school, in the universities, and even in Buddhism, you know, there is an exercise. Sport is very important for the children, and physiotherapy is very important, walking around and all this. But when it comes to the Rohingya community, we are very reluctant with the sport. Now, I have seen some new generations, they want to build mukis or muscles. They want to look like a Hulk. So they go for the, or to impress a woman or a girl or his peer group. So he goes to the fitness studio or to the sport hall or the gym. But there are majority of our elderly people, you know, they hardly go, and especially our women, I don't think so, they hardly do any exercise, which is very, very much needed. It's not only about the food, it's not only about the having a good nutrition or sleeping or enough, but we need to also take care of our daily activities, and which includes the movements. And then the chronic inflammation. Why the chronic inflammation? Because we don't take a proper medications. We prefer to pay attention to other things like, you know, buying a mobile, getting a proper dress. Of course, these are needed, but we hardly take care of our chronic diseases. As one of our, I think he's also one of the lecturer in this team, Dr. A.H. Kamal, he always says that I quoted from him, that we people go to the doctor when it is really between death and the life and there is no excuse. Good. Our fifth slide is degenerative disorders of the connective tissues. What is really the degenerative when the connective tissues are infected? One of the very what do you call important as well as very well known disease is the osteoarthritis. Osteo, this is Latin word. Osteo means bones and arthritis means joint. So anything that you come in future that you hear the osteoporosis, osteo something and osteoarthritis or arthritis, it means something to do with the bone and with the arthritis. So the definition of the osteoarthritis is the degenerative, as we said, it is under the connective tissue, joint disease due to cartilage breakdown. Okay. What is the cartilage? Noram andivulu hodun khodwa arar adum mare ji.
Suhor nadde har ke sunno ladde ho.
Okay,
Zura zura.
okay, Horan Adol and then Noram Adi. Okay, Adol. So these are the cartilage things. Okay, so there are pathogenesis, that's the mechanical stress. Yeah, mechanical stress means you are doing some kind of activities, or you're not properly working, or you're not properly walking, or you are in a work where these muscles are not properly functioning. They have a huge stress, they have a huge weight on it. So that is a mechanical, something which is you can influence it, you can change it, but then due to that mechanical stress that can happen. Okay, so second thing is the loss of cartilage. So when the bone is exposed to osteophytes, that means the osteophytes are the ones which are present in the bone, and if there is a loss due to any condition, it can also the one of the pathogenesis of the or cause of osteoarthritis. What are the clinical features? That we have the joint pain. Okay, तुम्हारा बुरा मंचम मारे दिक्कत बिशी आरर हितरा की हो ओफुत मारी नफारा मारी या ओबाइना मारी नफारा मारी, especially the older day आतो आड़े से सद्दे आतो आड़ू वोरे क्याल से सद्दे, क्याल means it is आरा जतो क्याल होई. It concerns, what I understand is the spinal cord. Kyalmani hips nova. Lekin iba mare ino ase. Good. And then binna udile matura bishi stiffness go jago inguriti aguri ingkalla like tagumza le matatra muscles so kalhin ara jism our whole body hitara noni gumza jago itara noro indela guro jago to hindela muscles call joints call imbukunoni contracto jago ane to gumo tori batasa sara move koile to ara ga kule diri zindela fulok ga raitole khonum fulok kalase zenne raitole enguri bono jago amato dinoti oti sunlight dekiti tara kuli jago. Okay, so same thing like this. And and then creptos ega arile mato that is you are mechanically doing it, but when you walk you have these clicks, you have some kind of I cannot say these are like in our community or in the Asian countries, in African cultures. These crepitus are usually known in a normal banazawa. Lekin when it comes to the European countries, he kamare adukala mater twar adile mator twar darakala mater holla ingula ile mator mate kalla, so these are the signs that there's something going on with our joints. Acha, the common joints, as I've said, joints, knees, adu, hips, okay, and spine. Acha. Can anybody tell me what is hips in our Rohingya language? Excuse me.
Lozura hadir.
Lodzura. Okay.
Lozura.
Okay, mattude tuana tu rohinga hata shikavuru. Okay, hips and spine. As I've said, ara komamare majority hips at the joint, yeah, spinal differentiate guru nafare, but it's good that you can do that. Okay. So the teaching point, wear and tear disease, non-inflammatory and primarily diseases. These are the ones, the causes. Okay. तो आर्गोस दे degenerative disc हमारे disc ने तो ये हमारे loss of hydration and in intervertebral disc दारा को तो आना दिक्कत फल्ला Ugwa dara de bishi lamba spine, okay, and they are vertebrate after once in the la click guri guri ugga kitawara hogguri ogguri rakke dirone to hitara head is in discase head noni fani homoja gude hatala fani homoja goi to yamato zenna bajaye fani homoja atike tika ekkan zaga mare herniate ho jago dis ekkan zaga mare herniate ho jalo goi herio iba cause utfariwo. So the symptoms are back pain and the radiculopathy. What is radiculopathy? It's quite personally, I not being orthopedic and not being on the orthopedic and also not being a surgeon, your neurologist, this has to be done with the X-ray, and some of the experts they can do it with the clinical science. Okay. আর ইবা মারে নার্ভ কল কম্প্রেসড ওদের মানে ডিংরি যত ফাঁস পুরা যাগোই ফানি হমে যাগোই হার্নিয়েশন হয় তার একজন সিবিয়ারে হেরে নার্ভ কল আর জানাতো বেশি করে নার্ভ কল জাদলনি ভেসেলস কল হিন কম্প্রেস হয়ে যালে গই এবারে হদে রেডিকুলোপ্যাথি আচ্ছা তোমারা মারে কিসর মাফ গজ্জ মত সুগার নামে দে বিকজ আই টুক ইনসুলিন and I did not eat. I'm sorry. Our second thing is, sorry, nutritional disorders affecting connective tissue. अच्छा और तो आगे होते पर सिर्फ degenerative tissues और कल जनीने connective tissue रे या affect करे और होदो nutritional. Just give me like 2 minutes because मेरे पास 2 minutes दो my sugar is really dropping. Okay. With the nutritional disorders, which affect the connective tissues, these are called screw way. I would not lie that I have not seen such kind of diseases or disorders in children, but women often use Some of the people have bone pain. Thanks hawa. Hodo manche ki hodo tu gura findera tu but dodda lambodda tanto thanks. Yes, that can be also one of the reason, but that can be also the reason in children because of this vitamin D deficiency. As I've said, it is very important for the collagen, and if it is not there, our tissues get weak and it can be very easily breakable. Then our next, that was because of the vitamin C. And there is another one which are quite famous. In Africa, this kind of diseases, I have personally seen only one of them, but not all of them. Then so the one protein, there is a protein, we have like carbohydrate, we have like vitamins, and we have like fat vitamins, water soluble vitamins, we have proteins and sugar and all those stuff. Protein is one of the very important ara jismalla bishi important hetala hodum vanche haina falli ara ki gori tarare extra protein shakes called diwane ara ajkal youth kolmare bishi extra protein called jimama zadi tara lowa, which is very important for our muscles, not only for our only body but also mainly for our muscles. तो ही नंबरे अतिक्या या ओइले हे प्रोटीनी बम्मारे उगोइदी की खवाशी core or protein deficiency or marasmus calorie deficiency, which I have seen in our community children, and in general I have seen very often this marasmus calorie deficiency in our community, in the Asian community, poor community, and especially in the African community. Effect on the connective tissue. What happens is that it reduces collagen synthesis. Jisamatu atikara protein na hile collagen synthesis no libo secret nobo are hiba synthesize nole hiba homizylo. This can be the reason. Then, as we said, poor wound healing and the muscle wasting. Thora dikone hoduna kol zin paralyzed kol oja goe या बुरा मानुष कल अट्टेंगे बेसवा स्वास वाला था कि दे एपिलेप्सी कल पेशेंट्स कल या जनिन तू लोअर बियाराम कल आसे या जनिन शुंदु जनिन आनी ना फारे बुरा मानुष बुतरियो a chronic बुरा फाइंडर बुतरे ठेंगे कल सियांसियो या paralyzed people, you know, because there is a muscle waste is there because of the not taking enough protein, as also at the same time not using them. Okay, then I don't know why this slide, I tried to change it differently, but it did not help me today. I really tried I could not change it. So it looks very funny, but I will try to make sure that you understand. And then we have nutritional disorders or diseases also, okay? Hibamare ara komare you know, people have to ara Huzu sallallahu alaihi wasallam not Huzu sallallahu alaihi wasallam. Okay, I will tell you a story to make this topic a little bit more interesting. Ara Huzur Sallallahu Alaihi Wasallam anoni bishi meda pasang goito. He loves sweets. So and sometime I think he used to eat more. তো দিননে আরা হুজুর সাল্লাহ সাল্লামের হেড়ে উগ্গ ফ্যামিলি আসে ফারফাতি উগ্গ মা আসে হতে কি রসুল সাল্লাহ সাল্লাম আহাতু তোমার তরফতে বানাক কেদা মদত লাগবে because you are our messenger and you are our people hear you and you have so much of blessings from Allah. Maybe you will be able to heal my son. My son eats a lot of chocolates. Okay, I cannot say it's a son or it's a daughter. He said the child eats a lot of chocolates, a lot of sweets. Then our Rasul Sallallahu Alaihi Wasallam had acha bujjam. So he said, come after 1 week. She was astonished, you know. He said, why after 1 week? Okay, she went because it is the messenger's request. After 1 week, he tells to the child, dear child, do not eat sweets. It's not healthy and it's not. Then she said, that advice he could have given a week ago. Why did it happen? Because our Rasul Sallallahu Alaihi Wasallam, he loved himself sweets, so he prohibited, he take that advice first. He reduced his sugar intake and then he gave the request to others. So it's a very beautiful examples, which we hardly do it. We don't care about ourselves, but we would like to advise others. Acha. Toi nutritional mare, we have like our body. It's very hard. Ara ko marahon situation amare America oat zede khana okol bishi shundo guri fa etara to enough nutrition সকল আছে लेकिन कैंप मारे हम न्यूट्रिशन सकलर कैलोरिक फूड नाफा हमफा हिंदला आरा बर्मा बुतरे but the same time उतरत तो जात तो बिशी आसे जात आर खुदन तो हम आसे और बुकन तो imbalance आसे कल्ला we don't have a balance means correctly portion of marathon bishi guri nakhon nige ara ko mamare ara bad bishi guri hayum gusto bishi guri hayum mas bishi guri hayum ar fast food okal hayum zanine Europe America Europe ma zaire hitara they also don't have the balance because we have less knowledge or it because our culture is all about food. We love food, you know, and ara edeshina mara ay badeddo Folashur mara khonakan desha mare ara kisu gotto jailiyo ya barato jailiyo. First thing we think about food, you know. So this is not only about the poor people, but it's also because we have less knowledge. We don't take it serious with our nutritional balance. So nutrition balance amare when the body gets too little, hamfa, yet too much or imbalanced nutrients. Ne? बात खाए सोल खाए ताकि आरा गुस्ता है ताकि मासरा हम खाए सब्जी खाए लेकिन इन देशों में आरा तो बर्मा था फरुद्दे कैंप में फरुद्दे नहीं तलावा लेकिन आरा तो गुस्ता नहीं लेकिन यूरोप में या अमेरिका में ऑस्ट्रेलिया में से तरह क्यों ही तरह गुस्ता है वो वहाँ खाए वो लेकिन तरह फाइंडनो नहीं सब्जी करना है because they are not used to it, you know. Okay, so as I've said, it can be too little, not too much. Too much is not, it's not that you'll remain healthy or it is imbalance. Okay, good. The deficiency disorders anemia, okay, it's and also rickets, excess disorders. Uba deficiency, there are a lot of diseases, but I just would like to focus, and that was I was given to speak on these two diseases, anemia and rickets. Excess means obesity, and imbalance disorders is electrolyte or protein imbalance. Marasmus, for example, is in the electrolyte mare to potassium ase khas pa mudikam de ba yeah, mainly mudikam de vitamin D there, potassium, you know. Potassium or yeah, call imbalance called dikam calcium or dikam phosphorus or dikam janine gura find butter bura mention butter ode. So we have like deficiency. It is mainly very well known among our people is anemia, rickets. I have hardly seen rickets here in the European countries so far, and the obesity is very much high in first world countries or the people because of fast food. and the electrolyte imbalance. Electrolyte imbalance can be due to the chronic disease also. Acha, number 10. I know this is the slide that I wanted to get rid of, but I could not. Okay. Zenoara diseases of the connective tissues of mare hinde in autoimmune nova. We have a rheumatoid or rheumatoid arthritis. We had osteoporosis, yeah, or osteoarthritis. This is a rheumatoid. It means it is autoimmune. You are born with it, okay? And it is because of the autoimmune disease. And the mechanism, there are a lot of autoimmune diseases, but for the arthritis or for the arthritis, that is the rheumatoid arthritis, it is autoimmune attack on synovium. It is one of the what do you call, one of the part of our joints and bones, and the formation of pannus. Iba kenode joints and no ase joint hinoni in a formation sa kanoni. Just one second. Hinoni kiode, are you there? Hello?
Yes, yes.
Okay, so in inner joint disformation clinically, but there are a lot of available in African countries. Okay, argoiside features. What are the clinical features? There's a morning stiffness. They said it's more than 1 hour. I don't know. I have seen also less than 1 hour. So even my symmetrical joint involvement, symmetric. It's not as what joint or the do oil do no adu over atar giro ile dinian atar giro obo ina giro shoulder giro ile dinu over, so it is symmetrical. Okay, it is not only one sided, and they are rheumatoid nodules called head of aza in Allah to clinically check good. Then okay, wait. Okay, so with the autoimmune, as I've said, there is a one called rheumatoid arthritis. Yeah. Second one is a systemic lupus erythematosus. Okay, these are it is mainly present in young women, and it also one of the autoimmune disease. It's a mechanism of different exposures, different involvements, and in this whether how you're going to differentiate is whether it is a osteo or rheumatoid arthritis from the SLE or systemic lupus erythematosus, that there is renal involvement is not there. Okay, Ibamarakada Rashaibo in the Lida Sanyamarakada Rashaibo, Lalmikyasai, or Ibamaraha Maha, Toyaga, Manushuga and Kola Atunoni, Arusisar, Anguma, deformity, symmetrically to decor, Dinianama shoulder mara decor, deformation of color, but then Atika Tora, Mala rashes a call dekile, Gala Sanyamare, Lala rashes a call dekile, or Toitwana Hamaha, Yamba Havurudeki, Bamare renal. शायद involvement आसफला renal involvement था के लिए इबो इधे SLE. Okay, good. Then the third disease of the autoimmune, which is also one of the very serious conditions, it is the scleroderma. Okay, so there is an excess ugomare different ugomare involved argument multiple factors are called involved ibamare bishoid. Okay, so the skin become thickening thona dikkan hodani hodun scleroderma colin. I personally have seen in Saudi Arabia, but lately it is I have not seen in Germany. Samakol Down ojaguri bishi down ojaguri. A renowned phenomenon ase, and then there is a fibrosis in the organs like in uterus and so on. Now let me just give you okay, now we go to anemia. That is one of the nutritional. No? Nutritional gyamare ara hoideki deficiency mare kadase dogga anemia argwase de rickets. What is an anemia? A condition where hemoglobin or red blood cells. Red blood cells is a medical, not a medical term, it's a normal English, and then hemoglobin is a proper medical word, where it is reduced, leading to decreased oxygen delivery. So now with this definition, we understood is that hemoglobin is very much needed in our body to uh, oxygen, to deliver oxygen or to our whole body, okay? So anemia is the one where the hemoglobin is less or red blood cells are less, and the red blood cells or the hemoglobin which is needed to deliver oxygen in our body, and when it is less, it is called anemia. তোরা যেটা ব্লাড ওয়ার্ক করো ব্লাড ওয়ার্ক মারে হেডে বেশি দিলা গ্যাকল আসবা মানে under the blood work mare hematocrit ase mcv ase henla beshi dilla kol asde hede tora dekhiba how you are going to define this is very very important mare tora iba yad gujjo tora example microcytic anemia maragwa ase norm cytic anemia ase argwa macro or macrocytic anemia argwa okay so uh,
Assalamualaikum, Shalom bhai. Makin mute karo na hame.
तो microcytic anemia मारे iron deficiency anemia, which is a common that we will going to speak, and then thalassemia में नहीं हमारे anemia उत्तर है लेकिन तरह inborn blood disorders में पैदा हुआ. It is not made it is not after they are born, it is they come up with this kind of genes they carry for the thalassemia. Then we have norm cytic. It is like honakan accident हुई है या renal failure हुई है ने तब हमारे उगा acute blood loss उगा से और उगा chronic disease से करा से. And the microcytic are the vitamin B deficiency and the folate deficiency. Okay, vitamin B and folate. These are microcytic. Now let us go, as we said, one of the main one of the most common among human are or especially among the old and the children is the iron deficiency anemia. Iron means ferrous. I don't know what you arakumma kyuba. Okay, so it is because of poor diet, okay, and which is of low iron, B12, folate, or there is a blood loss, women due to the menstruation or the injury, chronic diseases, as I said, renal failure, and also the bone marrow disorders na mare thalassemia tarafottu hina kolaide. Then the symptoms are fatigue, okay, pale skin, bishi dala. Sometimes it's very difficult to see or differentiate between the zin Rohingya zatokol hodun zin oriental মানুষসকল থাকে আরাদে খদু মানুষসকল আরা বেঙ্গলি দল ইন্ডিয়ান মানে দল দেখি আর খদুননি চাইনিজ সকল দল কোরিয়ান সকল. And it's very difficult to understand whether they are pale itara ba pale ne ya hitara ba wrong day, you know, olidda mikya pale mikya dola mikya handela. It's quite or they are fair in color. So you need an experience with that, and for that you need to see the sclera, you know, how, or the gums, how they are pale, or lips if they are pale, and you can see the capillary refilling group presgoriera. You can see whether they are pale or not, and how the capillary refill is working. Then they have a shortness of breath, dizziness, atu gurar, atu I for sai, and then cold hands and feet. Now, some of you might be thinking, oh, you know what Dr. Ambia said right now, these things my mother has or I have. It is not necessary that you have those symptoms because there are other diseases which can also cause these things. Lekin bura manusha call weak I believe that we all have some kind of disorders or diseases. It can be chronic, it can be acute, and iron deficiency, I believe majority of us have, unfortunately. अच्छा तो ये बम्बारे की करा फिर हाँ महा इबारे clinically तो तू दिक्को देखी बात है, it is important that you do a diagnosis. Okay, how to do the diagnosis? It's not only clinically, as I've said, we have to do the blood work, and then the blood work हमारा हमेशा unfortunately also I have to say we became doctors in Asian countries mafias. I always say, even in Bangladesh especially, but in this thing, we don't need any scan, we don't need any urine analysis, we need a CBC, complete blood account. Complete blood account number तुम्हारा है दिखिबा RBC red blood cells and the hemoglobin and other MCV, MCH and all the stuff. Okay, तो ये हमारे mainly है कि देखा वो आतिक्य है hemoglobin low oil, hematocrit low oil. Then we have to see whether it's a microcytic, it's a normocytic, or it's a macrocytic, and then we do the iron studies. Iron studies हमारे बा low तो the low है thai faribo. How is our iron, and then yeah, then we can diagnose this. Good. The treatment is iron supplements. Iron supplements of colomare, there's a ferrosanol. There are 50 milligram, there are 100 milligram. You can take once a week, once a day, twice a day. It depends upon how you prescribe it. The very important thing in this here is you have to give it with vitamin C for the better absorption. And second thing, you have to also involve the patient that it will not give you in one day the healing. You won't feel it. Maybe there is sometime our people, we believe in खुद चीज़ हमारे बिशज़ाले जल्दी affect हो जाएगा, but the treatment is not for one day, it's not for 1 week and then they stop it. No, you have to take at least for 3 months these medications, iron supplements for three, and then you do a blood work. Hushata के लिए blood work गोजी कि बम्बारा बना सिर्फ complete blood count गोजुम दे आरुंग गरानो हुरवो CBC गोजुम दे तो इधर आते क्या तिम्माश बादे गोदलो गोरी फाजुम न गोलने, but the effect to get the proper effect of this iron is for 3 months taking the supplements, of course. Then vitamin B injections are called. We don't, it is for the severe cases. It is for the severe cases with vitamin B deficiency, when the blood work is really, when the hemoglobin is very low, or the ferrous or in the blood, iron is very low. It should be severe form to give them vitamin B12 injections. But I have seen that in the camp and also in Cox's Bazar, every doctor give to every old person this vitamin B12 injections without even finding out what is the cause. तो हमारा patient call then हमारा मासूम कल आसी आ रहा है देखिए रहे वो क्या तो कम लगे, and then we feel better, and then हमेशा yan treatment yan over ara bishazaira or the young guri takiwa, which is not needed sometimes. And then we have to treat the underlying cause, where it comes from. Is it the khana hai na farid talane ar age hoy talane, ya aap to kisu renal failure ya cardiac failure, ya to kisu bone marrow problem hoy de, ya to kisu blood disease of class diyan. Okay, so how we prevent iron rich food? Spinach ra ara kummare ki ho jani. Spinach is very hardly found in our community mare iba khamfaza, but in the Middle East and also in the European countries very much found. Red meat, lalgo sahaballah, legumes, and then vitamin C, as I've said, improves iron absorption, and it should be taken in the empty stomach. Okay, যেটা তোমরা iron অকল দিবা ইয়াহনিকা তোমরা তো অ্যাড্রেস লিলে, you have to give iron supplements, and you have to make sure that they take in empty and give them a vitamin C together. Good. Now we come to the rickets. Rickets like 25 years ago, I have seen a lot of cases in Myanmar, but but maybe because I did not have that much time to focus on this one. A child rickets are mainly found in children, but sometimes it can also go an adult because of the chronic condition. A childhood disease causing soft and weak bones, due to vitamin D deficiency. अच्छा, तो तुम्हारा होगा दे कि Arako Marakala in Bishifaza, Africa Marakala Bishifaza, Kalla Bishifaza de another sun, because it is because of the lack of sunlight. तो Araki Gori तो sunlight तो किफाई मारा vitamin D फाइम देता ला यादे और कैल्शियम मध्य फॉस्फेट दूध खमहाजा की चीज़ कल खमहाजा जन्नीन मतलब कैल्शियम मध्य फॉस्फेट मतलब इसी क्या हो. So what we do is that it is very important कि होदे बारे थोड़ा सा आरा जत्तो हॉरकल फिनी ले लंबा बाजू फिनी वानो लंबा बाजू फिनी आरा मलफंदे लंबा बाजू फिनी which can be the cause arnoni sukakole gya shashma laga fe yumno sati lo yumone. It is very much important that our body exposed to the sun, especially this part amare 20 minutes indala loile matar sukloi sunlo arattu gyata huruvo. And then it will be what do you say, then it will help us from having rickets. And symptoms are bowed legs. Have you seen tangakol indalaguri takedia matlab indalaguri the bow legs to itara gura thaija goi amata tangamare duppa, and they have also weak muscles. Somebody has written something here. I want to check what he said. Okay, spinach means in the Rohingya language. No, it is not Horimahak Raifata. It is also not Raifata. Spinach mare bichidilla take Horimakaro hade morning spinach. It is not the this. Okay, good, thank you. Sorry. Then how we do diagnose? X-rays. We just do it with the X-rays. Okay, X-ray golle mato amato blood test mara aratto ha itara de CBC goribo, but we have to also make sure that we take vitamin D and calcium. Here calcium check kara hurubo, here phosphorus check kara hurubo, vitamin D check kara hurubo. Acha. Then okay, now rickets tai bamare ki kenguri gyagravuru, as I've said, vitamin D supplements, calcium intake, sun exposure, and prevention is sunlight exposure and fortified foods. For example anatu inara ki hoda food sakal zanni matlab oh god, dudakal fresh dudakal havuru, fresh cereal sakal havuru khudune inere fresh dudakal fresh cheezakal nahale he prevent no goribo. Acha, osteoporosis is also very important in youth akal mein bishi khamfaza, elderly manish akal mein bishi faza, and it is a condition where bones become weak and brittle due to loss of density. Okay, osteoporosis, osteoarthritis, these are different, and it is also har jammare inama joint of affectable degenerative connective tissues mare ya nutritional disorders of the connective tissues mare but mainly it can be because here we have to see what is affected. In the osteoporosis, it's a density. Yeah, the bone becomes weak and brittle because of that density. The causes are aging, hormonal changes, especially post menopause. Women in our country after 50, 55 years, they go through these hormonal changes, and then they have osteoporosis. That's why any woman after 40 in Europe, they define or they prescribe for them calcium, extra calcium and vitamin D. Vitamin D is also very important for me because with the patient during the winter days, I give always patients not calcium and all the stuff, but I do give them vitamin D, which helps really with our mood swings. There are a lot of studies are going on that the vitamin D can cause depression, and giving vitamin D daily, it adds good mood. Okay, and there will be less mood swings. So any woman who is going through a menopause, or they will have hormonal disbalances, so you can give them always the calcium and the vitamin D. And they have to also live a sedentary lifestyle. Then the symptoms, often silent, and then bone fracture, hip, spine, wrist, loss of height, shrink and stoop posture. The way we walk like this. Okay, good. Then the treatment, calcium and vitamin D supplements, medications, weight-bearing exercise. Okay, and then regular exercise, adequate calcium intake, avoid smoking and alcohol. Ibamara ratu alcohol the smoking no ratu fanade biri in bongara furwadiri, and then the diagnosis is done on the bone density scan, DEXA scan. It is a very expensive. I don't think so in Bangladesh in every hospital they have the facility to do it. But we do it. Okay, this one is 26. I will talk about it later. Let us come to the obesity. When I talk to your coordinator, he was saying that there is an obesity rise in our community in Bangladesh. But if you compare the obesity rise in America and in Germany, I don't think so it is that high in Bangladesh or among our community. Obesity. Obesity is a condition characterized by excess accumulation of body fat that negatively affects health. Examana ki marhala mare like 10 years ago ajjafan asefalla khutun family call mare accept gore falla ahara desham mare jatto age bo fine thwaite jaito bo fine no sorry bo thwaite jaito futalla. They always make sure that the lady is fair. Hibattu anemia hoidene, hibattu thalassemia hoidene, hibattu bladder kisu problem asidene anna sabu, but she has to be fair. White, it means she has a green signal to be married, to be taken as a bride. And second thing, oide muta hada garta ere hamsurut gori faribo, but they don't understand muta oile matar hitaratyo problemakal conditions akal asewa. Acha, commonly measured by the body mass index. So body mass index हमारे height, and then you see the weight. So ये हमारे normal ओइदे की 18 to 24 is the normal. Overweight is 25 to 29, and obese is 30. So whenever you give a patient, you are treating the patient, or you come across working as a pharmacist or paramedics and all those, make sure that even if you don't have the time and you are not aware of the body mass index to calculate good enough, always make sure alarm them that to prevent from the further gaining weight and to find out the causes. The causes of obesity, there are dietary causes, like fast food, sugary intakes, processed food, bakutumaga haidwara, ঘি অকল butter অকল দুধ অকল যিম processed আছে ইনখাই and overeating. Overeating, খাস তौर पर जीन फाइनल আছে ADHD or ADS or highly intellectual adolescents or children. They feel the world is boring, they cannot concentrate, they have a pressure. So food overeating can be also due to stress. And I believe that I would like to request our team or the coordinator that in future we make a subject on discussion on stress, because stress is the cause of everything right now. Yes, focus. Then we have a lifestyles, sedentary lifestyle, which is lack of exercise. তো তোরা হবি আইদে ফত্তিদিন আড়ি আইননি ক্যাম্পত তো কক্সবাজার যাই ইয়া কক্সবাজারত তো বিচে আড়ি আতো গাড়ি স্টেশন যাফরে গাড়ি স্টেশন আতো গাড়ি these are not the ones. It is good, better than nothing. Okay, like for example, I go to work also, I walk a lot there, but that is not the thing. You need to exercise. Exercise is very important for your brain, for your body. 15 minutes, 20 minutes, 30 minutes that you have a space. Okay, exercise doesn't mean that is not an exercise. There is another type of exercise which you need, because used to they stop affecting the body. Acha, so we know that excess screen time आजकल youth call in twara camp maro ok ara ke ok arkan zaga ok, the youth have an excess accumulation of median. Then there is a genetic factors play. If the women have a family or children who are obese, they will become also obese, so they have to be very careful. And then the genes can affect metabolism and fat storage. There are some diseases, for example, hyperfunction of the thyroids or thyroiditis. They can also give you an obesity, or cystic polycystic ovaries also can give you an obesity. Then these are thyroid disorders. Insulin, if you take often insulin, after some time your body resists, then you can also have the obesity issue. Then there are psychological issue, stress eating, emotional eating, and depression. Therefore that's why I was saying we need to focus on the stress in future, so that we can avoid certain other diseases. Okay, risk factors. Age, risk increases with age. Matlab I jato buroyum I moto obella to chances kolase. Urban lifestyle, lack of sleep, and certain medication. Certain medication also, like antidepressant, we have like fluoxetine, we have escitalopram, we have ADHD, like noradrenaline or sertraline. These also can medications which can increase, and also resistance of the insulin can also give you obesity. Then pathophysiology, excess calories are stored as fat in adipose tissues. Fat cells enlarge, then inflammation leads to metabolic disturbances like type 2 diabetes, insulin resistance, and hormonal disbalances. Symptoms are excess body fat, especially in abdomen, breathlessness, fatigue, and sweat. There's another one, Europe zare alcohol class excess alcohol haliyo manchattu obesity aye. Okay. And then diagnosis, as I've said, the BMI measurement, the body mass index measurement, most common method, and waist circumference, which indicates abdominal obesity. There are different types of obesity: pear-shaped, apple-shaped, So you can in khudun gyari diagnosis हमारे I don't pay there's so much attention on this waste circumstances, but it is written in the books. Then the blood test especially check the cholesterol level. Okay, cholesterol, low cholesterol level, high cholesterol level, it is very important for the fat people and also for the old people to check the cholesterol and the glucose. If it is possible, check the 3 months HbA1c glucose levels. Acha, complications, fat, oh my god, fat, obesity, it has complications everywhere. Bebana sirf sundar lano leda takon. I prefer people remain skinny, leda takon tuno, better mutat tuno. Tiba mare heart mare, cardiovascular, high blood, heart disease, high blood pressure, metabolic, diabetes type 2 janno ase ba majority muta mancha to de tala ibatto then musculoskeletal diseases, then we have joint pain, osteoarthritis, and then other sleep apnea to dikkano hodani khudum manusha like tengur mugrenga these can be also because of the fatness. Then liver is very fatty. So if the liver is fatty, your whole system will break down. It will not be able to function, and then we have other issues. Then reduced life expectancy. Honoga Manush, when we do the BMI and then we see that he is above 30, his BMI, that is very severe form, their life expectancy can be any time shorter and they can have heart attack any time. तो ये थोड़ा ला बिशी हेल्प बोदे खास तौर पर कैंप मारे लेड़ा मंचरे बना सिर्फ vitamins दे खाना दोनों बल्कि जीन मुटा मानुष्य कला से I my personally would love to request you to take care of them personally, to give them extra time, extra advices, because if itara wetana kisar kya gori faile, they will be away from many things, from depression, they will not be bullied at work, in the university, at school, and they have a high chances of getting married and leading a healthy life. Good. Okay. तो इबा management de baro kenguru lifestyle changes most important. We said batkhayre nagunzon batkhayre aron balance guru hon ane tomato low calorie high fiber arada hakusu bishi high, so it is good, but still we have to balance it. Then regular exercise. So regular exercise mare 30 to 60 minutes, it will be good, like walking around. We don't have those facilities, I know we don't have, we are lack in this, but atika thora bakule zaire camp mare kisani falle bakule kisani falle, that will be help at least 30 minutes. Acha, behavioral therapy mudahat to leki jamne, why? Because it's very difficult. Ara ko mottu shanti ne dede behavioral therapy, it will be very difficult, but for the children it works like, as I've said, cognitive therapy, that you educate them what are the kiki oit faribo scheme banaire kiki oit faribo hunto problem with farbo ki oit farto, that is a behavioral therapy, that is a cognitive therapy, and then you follow up them every week. Then we have a diet plans, we have to eat fruits, yeah, which have less sugar, vegetables, and then saturated fats like avocado. It though is oh my god, it is full of fat, but that is good instead of taking like everyday mangoes or bananas. Acha. Medical treatment हमारे हेरे खुदन above 29 सत्तरा average तो निसे हमारे middle के हमारे जागोई mild, no, middle to severe form ma zago. Some of the women and the people with cardiac problems and all those, we do prescribe them medications to lose weight. Okay, and then we have also surgical treatment. But the cosmetical la gore hodun deshamare government service la government pusha de ingori wala, but if it is cosmetic only, then they have to pay on their own, and they go to Brazil and India and then Thailand. Okay. Prevention, healthy eating habits, regular physical activity, avoid junk food, chips. cheese pa de hede bichi dilla gap kol, you know, Bangladesh ma zin junk food kol ase, these are very unhealthy, very, very unhealthy, but we do have sometimes cravings for those things, but it's not good. And then if we can manage kura findere agoloti twara tikka shuloti shikazi faile, that will be very kind. Okay. Now, I have a MCQ. Wait, I wanted to show you one thing. Wait. There is a one. Yeah. Okay. Here's a comparison. Anemia mare. This is important. Jara sona bana sirf matamara kibal for you alla. आगे ज़रा practically clinically exam alla. Anemia low or vitamin deficiency. Yeah, it can be iron, it can be vitamin. And then what is a key effect? That low oxygen in blood, we will have dizziness, we will have headaches, we will have what do you say, sleep disturbances, fatigue, and all the stuff. Obesity, excess calorie intake, okay, but but we have to make sure that we balance it. And then we have excess body fat, excuse me, especially on the body type. Rickets, vitamin D deficiency, and it is mainly in children, and their bodies are very fragile. Then osteoporosis, bone mineral loss, and fragile bones, especially in women and especially in adults. Good. Then I have a question. Okay. Which vitamin deficiency causes screw-away? I think I have already clicked it. Okay, it is a vitamin C. A patient with morning stiffness lasting for 1 hour, that is a rheumatoid arthritis. It's autoimmune disease. And then we have a person with the anemia. Most common cause of anemia, it's the iron deficiency. Then we have most common fracture site in osteoporosis. Most common fracture. Okay. Iba hono mata no osteoporosis le mata hono mata no hono humerus no hono femur. Ibo ide femur rang at the hip asade hiba ratihin fracture oderi. Okay. Rickets is caused by the deficiency of vitamin D. Good. Now I have a question. A 65-year-old post-menopausal woman presents with sudden hip pain after a minor fall. She has a history of low calcium intake and no exercise. Can anybody tell me what it can be? A 65-year-old woman with a menopause. It means she doesn't have menses anymore. She had a fall, and then she had pain. So what do you think? What can be the diagnosis of this? She has a history of low calcium intake and no exercise. Kampama twara zor. Ere manushugwa twara ashe, lady gwa ashe, ibe 65 years old. Ainoni suddenly Fojji Foribada Atu Kiana Mare Dupairai, a minor fall, no, Hono, but accident oidino, slippery oire, washroom mama forigegoi, ya Nisalamat dainty forigegoi, and then Ibeyenoni calcium tablets naha, dut naha, Arokia say yogurt naha, doi naha, and the Nana 65-year-old Bura. Hamo ham gore, I mean, gorma la rasana no gore, bo fine kole bukone tigori de. So, what do you think? What can be that?
जी जी अस्सलाम वालेकुम रहमतुल्लाह ये तुम मैं समझ चले उस मेनिफेसियल सिंड्रोम ये आरे बात तो कैल्शियम और बाप ये हार्मोन और बाप ये हार्मोन बड़े स्टॉप करे कैल्शियम और बाप ये आरे ली बात तुम बहुत दरों ना ज़्यादा जंतरा कर करे এই আনলে বেতন নিয়মিত মানে দেখি এক্সারসাইজ করা পুরো লড়াচড়া করা পুরিব এলা যোগা দুয়কল আছে দুতকল আছে এলা ক্যালসিয়াম জিনিস হলা যেমন আছে স্পিনেশ ইন হা পুরিব গুলাগালা হা পুরিব ইন যে ক্যালসিয়াম হা পুরিব ভিটামিন ডি তেরি মাদের টাকা পুরিব
Excellent, excellent. I love your treatment, but and I love your also way you're directing yourself. You see the, but what do you call it, the disease? Osteoporosis. ane? Osteoporosis. Okay, as you said, she has the hormonal disbalance because of the menopause, you know. And is there anything that you would like to do and scan? Atike ba tuangrole ফাইনাকল আমেরিকা তাকে নাতি ফুটিয়ান সৌদি আরব তাকে আরা দাদিরে আরা খেয়াল রাখুম কি করা ফুরবো যে তোমারা কি করতে হইবা কি 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 diagnosis কল clinical you did a very well job. The diagnosis is osteoporosis, but do you want to refer her for any scan or anything, or any blood work or urine analysis?
জি জি তো নিয়মিত মেডিসিন ডক্টর লেয়ার পরামর্শ করে আর দল মানে ডক্টর চেকআপ করা পড়িব আর হলে নিয়মিত মেডিকেশন করা পড়িব রেগুলার চেকআপ করা পড়িব এক্সারসাইজ করা পড়িব হেলথি ডায়েট অকল আছে ইন হা পড়িব ইন করা পড়িব আর হলে অ্যাভয়েড স্মোকিং বিড়ি হাত ধইলে বেরা বন্ধ করতে হবে পড়িব আর হলে পান জর্দা হাত ধইলে জর্দা বন্ধ করা পড়িব আর হলে ফিজিক্যাল অ্যাক্টিভিটি রে ঠিক রাখা পড়িব ডক্টর পরামর্শ করে আর ওষুধ দিন ওষুধ নিয়মিত হা পড়িব
Good. अरे रे मतलब डॉक्टर को तू गियो तो दादी रुफाती या तो मामार फाती तो मामा 65 years old या दादी 65 years old डॉक्टर हद के बांग्लादेशी डॉक्टर हद कि we need to do a DEXA scan ने DEXA scan करा बुरो बुलो केसु ब्लड वर्क लेके दीबो एक्सरे लेके दीबो DEXA scanner लेके दीबो. Will you do all those investigations? If yes, why? If no, which one? Blood work, urine analysis, CT scan, MRI, DEXA scan for the hip or for the spine. Okay. Difficult, we will not do it. It's a minor fall. She's 65. If needed, we can do one x-ray, but we don't need to do any DEXA scan for the whole body. We will do a blood work just to check out whether she has why she, after falling, she has this fracture or not fracture, why maybe she is having some deficiencies, you know, that's all. Otherwise, if I'm very much limited with my money and I'm in the camp, you know, you people are treating the people in the camp, we will not go for further so many things. We will just say, fall badana ki gujum, एक्सरे गोरी फैले गुज्जुम न गोरी न फैले हेमली की डम्मा तू फैला आराम करो पेन किलर को लो कैल्शियम मते विटामिन डी को लो अन्ननी गमो जाले गोई like 4 to 6 weeks बादे तू एक्सरसाइज गुज्जो ओके कल्ला मनुष्य बत्तु दर्द हुआ. Otherwise you did very well. I don't know who was that student, but you did well. Good. I am almost done with my presentation, and if I'm not wrong, I have sent already to your coordinator my presentations. Somebody has written to me something. Ji Junaid Khan, you are right. Ibar hodini ke raifata? Okay.
Ji, ibar raifata hodo hona zara hota.
Acha, ibar luturo ni bishi fattoro idun nahayo. Mammare fattoro bishio. But it is also very much needed food. Ana deshamade hak kusede bishi asa hak bishi lal shak marisha hak idun hak asde. So we have a lot of good foods out there. But
lekin arkan swal go tumo dese
ji
zono osteoporosis ase ibalero osteomalacia go ase ibalero fatikyo ki
acha hibamare osteomalacia, it is mainly found in children, And osteoporosis, it's a density. Osteoporosis, it's a density. Malaysia mare head bone circle defect ho jago de. Bone sudda myelite circle head effect ho de.
যারা নাকি বেশি স্টেরয়েড জাতীয় মানলে মেডিসিন সকল ব্যবহার করে এই তারা তুন ওইবার বেশি সম্ভাবনা থাকে না যে আর যারা ওবেসিটি বেশি আছে এই তারা
amma to hosai tui mo to aswala no buzo
যারা নাকি মানে অস্টিওপোরোসিস যারা তো মানলে ও হিতারা রইলে মেন কারণ বলতে স্টেরয়েড জাতীয় জানুন আছে স্টেরয়েড ডেক্সামিথাসোন প্রেডনিসোলন ইন হাইলে বেশি হওনি কি জানলে
yeah bishode no in lo cano de tika yes very very good question you know the cortisone extra cortisone will always affect our bones hatalla not only the bones it will also affect our immunity system therefore extra cortisone are not allowed to take especially in women
জি জি শুক্রিয়া বুঝছি জি
ne acha ya কি হলে তুই osteoporosis of the osteomalacia osteoporosis of the osteomalacia mare you will see that the whole bone the whole overall bone mass will be affected gora bone noni ba affectable ane আর osteomalacia mare hiba mare mineralization কি হদে জেনানি বে দর গরিব হিবা প্রসেস হিবা মারে আড্ডি দর গরিব দে হিবা মারে প্রবলেম আইবে দুবা আড্ডি দর ওইতনা পারিব দে প্রসেস হিবা মারে মিনারেল সকল হিবারে মিনারেলাইজেশন গরিবাল্লা বলি হিবা মারে ডিফেক্ট আইতে তাল্লা হিবারে অস্টিওমালাইসিয়া হ আর উবা মারে গোড়া বোনরে এফেক্ট করে দে এটা ওভারঅল লস অফ দ্য ওভারঅল বোন বোন বানাবেলা প্রবলেম করিব দেবে মালয়েশিয়া হব জানুয়ারে বানা সির্ফ প্রসেস আমারে গিয়া কি হদে ডেন্সিটি মারে one is density one is in the process of making the bones osteoporosis and osteomalacia
জি জি শুক্রিয়া বুঝছি জি
okay I think we are done so I wish you all the best if there's no question see you next time Allah Hafiz Assalamu alaikum
Thank you. Walaikum assalam warahmatullahi wabarakatuh.
Allah Hafiz